quorum 都夠。
All right, I think we can start because we've already got a quorum. Mr. Wong Yok-man has to attend a court hearing, so he will be late. Mr. Gary Chan is on his way. So let's invite the witnesses in.
睇得晒佢啲 OK 嘅啲文件。嚇？多謝晒。
Thank you very much. I thank the two secretaries, the permanent secretary, and their team for coming. So we're studying Chapter 4 of the Director of Audit's report number 59. So concerning R59/4/Gen 1, this is a paper from the administration dated the 21st of November, and then we've got a paper from Baptist Hospital 59/4/Gen/2. If you don't have the paper, you can ask the secretary for a copy. Any declaration of interest, Paul? I am a member of the Court of the Hong Kong U. I'm a member of the Council of the Hong Kong U and also a member of the Court of the Hong Kong U. And I'm also a director of Sin-chong and New World. Now, because I'm declaring this interest because they may be interested in bidding for the new private hospital sites. All right, shall we start? Alan, you can start, and you have 15 minutes. Thank you. Thank you, Chairman. Chairman, with regard to Chapter 4 of the Director of Audit's report number 59. We are having this hearing today mainly because we want to look at the implementation of a government policy. In other words, granting of land by private treaty at nil or nominal premium to private hospitals. We want to know whether this policy or the implementation of this policy is in line with public interest. In 1957, and then there was an elaboration in 1981. Now, the policy is that the government is willing to forego the premium in return for benefits to the public when they need to use public or rather private hospitals. We are told that there are the two salient requirements to give effect to the policy whereby the government forgoes the premium in return for benefits on the part of members of the public. And the two salient requirements are namely the need to provide free or low charge beds and the plowback requirement. But then, with regard to these two salient requirements, either they were not included in the land grant conditions for the private treaty grants, or even if the requirements are included in the grants, they are not implemented. And on a number of occasions, the Executive Council before 1997 and after 1997 was not consulted when there was deviation from the policy. Concerning the hospitals B, C, D, E, F, and also G. G, of course, mainly relates to Part 4 of the report. Before I ask specific questions about the various hospitals, can I ask the Bureau and the departments concerned their respective roles in this policy? Now, in 1957, the government came up with or formulated a policy whereby the government would forgo the premium in return for benefits for the public. So, in terms of policy, which Policy Bureau was responsible for formulating the policy and implementing the policy. We have two policy bureaus here, so we'll ask them who will answer this question. We have the Secretary for Development here. His bureau is responsible for the granting of land, and we also have the Secretary for Food and Health here, and his bureau is responsible for the implementation of the policy. Mr. Ko? Yes, Chairman. I want to talk about the policy of the bureau concerning the provision of medical services. After the land for the private hospital has been granted, now, as Mr. Leung has pointed out, we charge new or nominal premium, and so we do require private hospitals to provide concessionary arrangements for members of the public in return. So this is the primary responsibility of our bureau in this matter, because we are responsible for the provision of medical and health services to members of the public. So we are responsible for proposing and putting forward suitable conditions for private hospitals. And then the Department of Health is the department responsible for monitoring the performance of private hospitals. It has to step up continuously the monitoring of private hospitals. And the Department of Health also has to make sure that the private hospital or its operator complies with the land grant conditions. So concerning what conditions are to the benefit of the public, and at what time we should put forward conditions concerning the provision of suitable medical services to the public. This is our responsibility, and of course the DOH is responsible for monitoring private hospitals, so it has to ensure that the private hospitals comply with the land grant conditions or the lease conditions. Now, Ellen, please wait. I think I'll also need to invite the Department of Health to respond. And also, the Lands Department, the Director of Lands, also needs to supplement, because the Lands Department is responsible for enforcing land policies and lease conditions. So I want to know how the Director of Lands implement this policy. So I think I'll invite them to reply. I'll ask them to state their respective responsibilities, and then you can continue. Yes, Chairman, thank you. With regard to private treaty grants that have to go to EXCO for approval, then generally speaking, we'll have papers for circulation within government as to what lease conditions or land grant conditions should be included. Of course, the Lands Department will propose some general conditions, but then concerning conditions relevant to the operation of private hospitals, these are for the Department of Health and the Food and Health Bureau to put forward. For cases which went to the EXCO might, in the course of its discussion, lay down certain conditions, but then many years have lapsed, and so we do not have records showing us why a certain requirement was not included in a particular grant, or why the wording in a particular grant was a bit different from the norm. In some cases, the initial grant was approved by EXCO, and then a few years later there might be lease modifications, or there might be some land exchange arrangements or re-grants. And so when there was land exchange, when there was lease modification, the Lands Department would look at the changes proposed by the applicant. Now, the changes might be technical in nature only, but then our established policy is that we will circulate all the amendments or revisions among relevant bureaus and departments. In future, now, or should I say, now, when there are lease modifications proposed, we and other departments only look at the amendments in question. For example, parking spaces. So when the papers are circulated, departments and bureaus may only look at the parking space issue. But then we know that in fact it's an opportunity to include certain other conditions. Of course, it's up to departments and bureaus to decide whether such extra conditions should be inserted. Now, I want to ask the heads of departments to reply. Now, because I want to say that the Director of Lands should not only look at the modifications proposed. You have to continue to enforce the lease and the lease conditions. The grant and the lease are your responsibility, and as now we have this gap. We have this problem pointed out in the report. I'll give you an extra 15 minutes, Mr. Leung, but I think it's important that they clarify their respective positions. Yes, thank you. Chairman, just now I talked about modifications of lease and land grants. But how do we enforce the lease, Chairman? In fact, the Lands Department in the case of special private treaty grants, for example, hospitals, schools, welfare organizations, we expect the sponsoring bureau or department to carry out day-to-day monitoring, because they or their work is closely related to the work of these organizations. So, say if the department concerned detects subletting, for example, then the department will approach the Lands department for an interpretation of the grant or the lease, and whether the grant or the lease has been violated. And the Director of Lands will of course follow up the matter with the relevant bureau or department. So Connie or Constance, do you agree with the Director of Lands? Chairman, in the process of formulating and modifying the lease conditions, of course, the Department of Health, as the sponsoring and responsible department, has a chance to give our input. And then we do enforce the lease and the grants. Now, say for example, reports to be submitted to the DOH, low charge beds, and also facilities that require the approval of the DOH. Now, in our routine inspections, we said at the last hearing on another chapter that we follow the code of practice. We look at the level or quality of service. And concerning the content of the lease or the grant, if we suspect that lease conditions have been violated, then we'll refer the matter to the Lands Department for follow-up. So it's your responsibility to bring these matters to the attention of the Director of Lands, right? I think this is a very important point. That's why I'm willing to spend 15 minutes to ask you to clarify your respective roles and responsibilities. Chairman, in fact, there are a lot of lease conditions or grant conditions. There are some which are within the responsibility of the DOH. For example, submission of reports on charges to the DOH, low charge beds, facilities to be approved by the DOH. All these we look at. But then concerning other conditions in the lease, if they come to our attention, then we'll also refer them to the DOH Lands, but then we, in our inspection, will not look at all the conditions in the lease or in the grant.
Members, what do you say? Maybe you should raise your follow-up questions. Mr. LEUNG, I'll give you back your 15 minutes. I want to clarify the division of labor, the respective responsibilities of the departments and the bureaus before I proceed to ask questions on individual hospitals. So you have done it very smartly, Mr. Chairman. With regard to enforcing of private duty grant conditions for hospitals, from what I've heard, the Director of Health seems to accept this particular view, and that is through their regular enforcement activity, they would enforce the lease conditions or grants conditions. According to the Director of Lands, through the routine enforcement activity, say the Department of Health has uncovered certain problems, certain issues, then the Director of Land will be asked to advise. The Director of Lands will seek legal advice and take appropriate follow-up action. So far I've heard from the two directors that that's the case, and do you agree with the description? Well, if it's in the land lease that something should be done by the Director of Health, then we'll do it. Director of Lands, I agree. I think in a moment, other members, or when it's my turn, I'll raise further questions, because there's something outstanding here with regard to the Director of Land's remarks. if you just handle individual applications, you may lose sight of the need to have oversight at the macro level. But I'm not going to pursue this further. Maybe I can put down a marker that I'm going to follow up this later. Of course, you are talking about conditions pertaining to the grant of land. But who is responsible for this government policy of 1957? And make sure that the policy can be implemented through the imposition of private treaty grant conditions. But now, of course, it's the Development Bureau. I've not learned from the Secretary for Development why this policy of 1957 was not incorporated in the form of conditions in the private treaty grant. Because if you haven't done that, the FHB or the Department of Health cannot enforce them. So I want the Secretary for Development to respond. Paul, your response. Thank you, Chairman. Thank you, Chairman. In the formulation of policies on private hospitals, as mentioned previously, the formulation of policy and policy objectives comes under the Food and Health Bureau. And in terms of implementation and enforcement, the Director of Lands, the Lands Department, would incorporate suitable conditions in the lease so as to implement the policy. And before the grant is made, there will be circulation of papers within the government with regard to the need to incorporate suitable conditions covering different policy areas and what the specific and targeted conditions should be incorporated. So that will be done through internal circulation. Maybe the Director of Lands can also supplement. Can you answer the question, Secretary, concerning the policy of 1957? Perhaps, Mr. Leung, you can also repeat your question. I don't think it's useful or fruitful to repeat my question. Maybe I can refer the Director for Development to Table 2, page 9, which paragraph 2.10, say, Hospital C, land grant 3. There are requirements of low charge of free beds or requirements on reinvestment of income. It's not in the lands conditions. For C, there's no free or low charge beds. Land grants 4, no free or low charge bed requirement. Land grant 7, again, no free or low charge beds requirement. Land grant 5, no profit surplus plough bed requirement. Land grant 7, again, no requirement on both issues. So who is responsible for the lack of either one or two of such requirements? I would say it's the responsibility rests with the Development Bureau. Do you agree? Well, we are not here to shirk our responsibility. As far as I understand, we cannot just generalize things here, because we could not trace the or we cannot get the documents with regard to the grants made back then. But generally speaking, when it comes to the grants of a site for a private hospital, the Director of Lands would circulate documents within the government and certainly to the Food and Health Bureau to see what conditions should be incorporated in the grant. And if the Bureau doesn't propose some conditions, then such conditions might be omitted from the grant to be made by the Director of Lands. The Director of Lands would like to supplement. I would like to say that it's not just about grants for the private hospitals. Other private treaty grants would be dealt with in such a way that all the conditions that are related to certain policy areas would hope would come from the relevant bureaus. I just want to tell members what the system is about. We're not trying to share our responsibility. In individual cases, in Table 2, although you see a clause in some of the boxes, there you can see that the Director of Audit has put in some notes. For example, Hospital D, Land Grant 5. Why is it that for profits and surplus plowback requirement, there's a clause there, there's a note there? It was not actually up to the individual government departments or bureaus whether this should be put in. It was actually considered and decided by the EXCO to see whether certain conditions should be put there. Even for private hospital D, well, we'll check our records. With regard to free or low charge beds requirement, B, Hospital B gets a clause for that box. Actually, the EXCO to consider whether it should be put there, and it was decided by EXCO that it shouldn't be there. So it's not up to any bureau or department to see whether this condition should be put there. But of course, there are other cases whereby the records are incomplete and we cannot really trace all those. So the two bureaus are not trying to pass the buck around, but it was decided by EXCO, but you cannot give us the details because the records could not be traced. Maybe when the CGO was relocated, those records were burned. So maybe that's another thing that I want to raise. If we allow the government to burn the government records, then we can close this PAC because they can all come and say that we cannot find any record. That's a serious issue. If you don't want to answer any question, you can just say the records back then have been burned. Full stop. That's a very poor arrangement. We must come up with more ideas to legislate for archives, government archives. With regard to the statements made by the two witnesses, although the EXCO was supposedly collectively responsible for this, and before the handover, it was the governor. After, it was the CE or the executive council. When it comes to land grants, land use, or lease conditions, if you do not formulate the lease conditions in accordance with the 1957 policy, then the Secretary for Development must be held responsible. It should not be the responsibility of some doctors. Mr. Chan, Chairman, I'm not saying that because I'm new to the post, I cannot give an explanation and I cannot find the documents. As a matter of fact, my colleagues in the Bureau did try very hard to take out the relevant documents which are relevant to the Director of Audit's questions. but these were the documents that date back a long time ago. As for Mr. Leung's question of responsibility, as I've said, I'm not trying to share any responsibility here, but according to the existing policy, with regard to private hospitals, the policy maker is the Food and Health Bureau. They have certain policy objectives that they try to achieve, and in the grant of land, our colleagues in the lands department would help to realize and implement the relevant policy. When the two directors testified, they both mentioned that after the land is granted, and in relation to the implementation or monitoring of operations of such private hospitals, it will be for the Director of Health who would arrange frontline people to inspect the hospitals. But of course, there's a lot of room for the improvement of cooperation between different departments. I asked a question. I put in an aside concerning archival law. I'm not saying that the existing director for development is putting up an excuse of the failure to take out the documents. I'm not saying that he's using this as an excuse, but that's just an objective fact that you cannot trace the documents. Dr. Ko? Although the lease conditions are decided by the Director of Lands, when there's opportunity to renew the lease or to grant a site, the Director of Lands would consult the Director of Health or the Food and Health Bureau, and we in our bureau would look at our policy objectives. Since we have forgone the land premium, how can we make sure that through the imposition of certain conditions, certain benefits can be conferred on a certain sector of the community? So we would raise our views when the Director of Lands is considering the conditions to be imposed. In Table 2, there are a number of land grants, for example, 3, 4, and 7. There is no requirement on the free or low-charge beds. As far as I understand, as you can see in Note 1, at that time, there was the joint declaration. Then there are some requirements, and except the short-term tenancies and leases for special purposes, all leases granted which did not contain the right of renewal and would expire before the 30th of June 1997 might be extended for a period expiring not later than 30th of June 2047. So it was the understanding of the departments as well. And that is when the lease was up for renewal before 1997, and we were consulted, and we were aware of this policy. So we did not deliberately impose more conditions in the interim, in the transitional period. Maybe that's the reason why we didn't do that. Maybe I should wrap up and allow other members to ask questions. Well, no one is on the queue. Let's see a hypothetical example. A site is granted for hospital, but they cannot make the full use of the entire site, and they want to change land use. In this case, we would not expect that the Secretary responsible for health care to raise the matter in EXCO. It will be the Secretary for Development, because you want to change land use, you want to change the planning. all of these are the responsibility of the Development Bureau. Would you agree with my description? But that's not a hypothetical question. That's very much a real case in point. A real case in point. Maybe the Secretary for Development can respond in the next part 4. This is not exactly a hypothetical case. Thank you, Chairman. In a moment, we are going to have a very detailed testimony at the next stage. If there's a change, then due process has to be followed. For example, an application has to be submitted to the Town Planning Board to rezone certain part of the original site. That's another procedure. The Town Planning Board procedure is independent. When we proceed to the relevant paragraphs, I'll invite the Director of Planning to respond to one of the important cases which members are concerned about. Before I give the floor to Mr. Paul Chair, I want to clarify a few points of principle. Secretary, you referred a moment ago to Note 1, that prior to 1997, the leases would be allowed to be extended to 2047. Have you got a chance to look at these 7 leases, whether there's a need to have modifications? Table 2 points to a big problem. Do you have any information showing that you have checked the documents, that there's no need for modification? Or do you just allow the mistakes to linger? Do you have any documents that you can show us? Maybe the director can also help us. I'll talk about the principles. Well, we understand the principles. You have explained the principles thoroughly already. It's in Note 1. But what have you done with regard to those principles?
If you're only talking about principles, then we will not get an answer to write our report. So can the director tell us what you have done? Can you show us any information that you can accept this principle? Because this is related to public interest. As Mr. Leung pointed out, it showed that a section of society should benefit, and they did not. And the government suffered from revenue foregone. Director. Table 2, Note 2. According to the Department of Health's information, please turn to page 11, table 3, table 3 English version, page 15, and it is in relation to hospital C, LG3. There is also a Note 2. And there is also LG7, land grant 7. There is also similarly a Note 2. Please refer to page 12, Note 2. That is the English version, page 16, Note 2. In relation to information dug up by the Department of Health. According to our record, in relation to LG3 and LG7 on 2 occasions, the relevant department submitted to the Hospital Services Department, the then Hospital Services Department. As Note 2B says, it was intended that the leases would be extended on the existing conditions. Only certain basic and essential conditions would be amended or inserted where there appeared to be serious defect in the existing lease. The then Hospital Services Department did not incorporate any further conditions apart from a renewal. In Table 2, it shows that there are lots of things were not done, but you continue to not do them. So you have, on the face of it, it was nothing special, but in fact it is a very special situation. May I get a chance to answer? Yes, please go ahead. There is a policy. The policy is for private treaty grants at nil or nominal premium, certain requirements will have to put in that to benefit a wider section of public. And if there is no such condition or requirement in the private treaty grants, legislators expect the department to incorporate the requirement when a renewal comes up. But the situation differs in each case, and every time different factors will have to be taken into account by the department. One of the factors is to take the opportunity to incorporate the requirements to reflect a policy objective. Yes, I agree, but there are other conditions. On the free land grants you've just mentioned, there is a special situation. The renewal did not come up because the hospitals would wanted something different. It was just when the original lease expired, and it's said in one of the notes. According to the joint declaration, if certain leases would expire at a certain time, then it may be extended to a period not later than 2047. Of our understanding of the joint declaration, when it comes to lease renewal, the lease conditions will not be changed simply because of the 1997 issue. And when there is a routine renewal, my understanding is that the department is aware of this general policy in relation to the transition to 2047. So they knew full well there is a requirement that is to be incorporated to benefit a wider section of public, but they have to weigh things up. If you want to enable a smooth transition, then it should not be affected by the other requirement. That's why they did not seize the opportunity to incorporate it. I think it is not a matter of right or wrong. I think it is because of this reason why the requirements are not incorporated, because they would like to ensure a smooth transition first. Yes, I agree with what you've said. But we're talking about a core issue. It's not to incorporate a condition. It's the fact that something should be there was not there. Yes, your thinking is right to explain why it wasn't incorporated. But what we wonder was it should have been there in 1957, and since it was not, it should be put there in 1997, but it wasn't. And I would like to raise another issue which is quite important. The director for lands just now referred to an EXCO document. It is more an exception to the rule, and that is not what we're talking about. Mr. LEUNG was talking about the rule. You mentioned in the note a special situation, and you refer to a document, and we understand that. But Mr. LEUNG's follow-up question points to the spirit of the entire report. How do you explain in general situations you fail to do so because you only refer to an exception to the rule rather than the rule? Well, would you please give us an explanation, because we will have to write a report. Director. If the issue is in relation to an expiry before 1997 and it's to be renewed, then the situation is indeed what as the Secretary said. Let's leave aside private treaty grants. We're talking about tens of thousands of lease renewal before that expired before 1997, and there was a law stating that the existing lease will be maintained to ensure a smooth transition. And we're talking about quite a number of private treaty grants. Hospitals, education, social welfare, and various organizations. We're talking about hundreds or even more than 1,000. We retrieved the records, and we found that the Lands Department's comments to policy bureaus was that no additional condition is to be put to ensure a smooth transition unless there is unless it's a special situation in which a special situation that warrants the incorporation of additional conditions. As Dr. Cole said, that the situation was taken into account. These may not be additional new conditions, but to the grantee, if it wasn't there and is added to them, it's a newly added condition. A balance had to be struck, and we have to take into account the special situation and also the need to ensure a smooth transition. Mr. Porter, I'm not a solicitor specializes in conveyancing, but every time the cost of conveyancing is a lot lower. It's just 2,000 or 3,000, but you will have to in every transaction or conveyancing transaction, you have to read the entire lease from top to bottom, and if you fail to point out the irregularities and if you fail to plug the loopholes, then you will be held responsible. I understand that during the transition period there are lots of leases to be vetted, but is it a justification to just gloss over them? And question in passing, in Table 2, for private hospital C, LG3 and 4, D, LG6, E, LG7, and F, LG9, yes, renewal was done at around 97 to 2047, but whereas the others have got no problem because they've been renewed earlier. How do you explain that? Is it because there were no records, there were no documents, that's why you can't explain? Who is to take this question? Dr. Cole. For leases that are not extended to 2047, my understanding, say for example for private hospital B, yes, it was granted in 1967 and it was not incorporated, and the policy was already in place in 1957, and we really cannot find the documents involved. We reckon that since it's a smaller hospital with a smaller number of beds, say just a few, the incorporation may cause operational problems, or it may not create a benefit that is meaningful. D, LG5, is explained in Note 4, I think. The EXCO considered it, and it's explained in Note 4. And which other one? F? LG8? LG9. LG9 refers to quarters, so this is not applicable. LG8. Table 3A. LG8 is a land exchange. And in E, Table 3, you will find an explanation. Mr. Zhe, any follow-up? Well, we're not going to individual pieces of land, but we've spent the time to try to find answers, but failed to do so, to get to the reason why these two salient requirements were not incorporated. It seems that the answer is that the information is incomplete. The document is incomplete. That's why they can't provide us with an answer. Dr. Cole. No, we try to answer case by case. We've one of the reasons is because of the transition issue. At that time, the department has considered the two factors, but since they would like to ensure smooth transition, they did not incorporate the requirement that should have been incorporated. And if we add individual conditions, it may affect a smooth transition. And as to the third situation, well, there is not really any documents to show you the information. We're talking about private hospital B, LG2. We deduce from experience of operation that it may be because of the small number of beds. The incorporation may not produce a meaningful benefit. And in the notice, talked about the EXCO decision, and in Table 3 and Note 2, and that is an arrangement related to land exchange, and that's why there is some flexibility. Mr. Zhe, has he answered your question? We're talking about two issues. First is when the condition wasn't there in the first place. And the second issue is that it wasn't incorporated when the opportunity arose. We would go into details later, but back to the first issue. Why wasn't it there in the first place? And the only answer we've heard so far is, well, because of incomplete documents, so we can't give you an answer. Dr. Cole, can you try to help us get a better understanding? In 1957, there were already two salient requirements in place. Are you saying that in 1957 there weren't these two salient requirements to be considered by the EXCO? You have to look at the core issue. At that time, these two salient points it is not a must for these two salient requirements to be there. I know that you weren't in office, and it would be difficult for you to give an answer without the documents. Well, when the requirements are not put in when the land lease was granted after 1957, that is, that they're not even there in the first place, well, we don't really have the documents to help us explain. Director for Lands, can you give us an answer, because we have to resolve this issue before we can move on. We keep asking questions, but you failed to give us answer. It doesn't help us into finding to find the truth. I believe the Department of Lands will have the information or the document. Well, based on documents that we can find, I'll go to each case one by one. Table 2, Hospital B, free or low charge beds requirement. This requirement was not incorporated. From the information we can get, we deduce that the EXCO considered grounds proposed by the grantee, say for example difficulties in providing such bed. So you have some EXCO documents. I saw documents mentioning considerations made by the EXCO. Did you read such documents, the audit commission? Yes. C, LG4, free or low charge bed requirements. There is a cross. I see that in 3.1 paragraph 3.16, there was it was considered and it was deemed suitable because it was a day hospital.
And then LG5, profits surplus plough bed requirement. Members can refer to note 4. And then LG7, as the Secretary has pointed out, the first grant was made in 1930, in other words, prior to 1957, and that is why the two salient requirements did not appear in the grant. And then LG8, free or low charge beds requirement, you can see half a cross. And I think you can refer to 2.19 for the considerations behind. Thank you. Chairman, I think there is a very big loophole, judging from the evidence we've heard. So it's for the Lands Department to enforce the lease or the grant conditions, but it seems that the Lands Department doesn't really do any frontline inspection to make sure that lease or grant conditions are complied with. And so we're worried that after the grantee has got the grant, then he or she can do whatever he or she likes. And we don't know what's happening to grants relating to schools or welfare organizations. So we really do not want this loophole to continue to exist. Is there anything being done to plug this loophole? Thank you, Mr. Cole. Yes, Chairman, thank you. We do accept the Director of Audit's report. So, from the policy perspective, we need to consider the various modes of grants to private hospitals, of course. One mode is the operator owns the site, and then the second is grant of land at nil premium. But then, in the recent case, it's really something in between, because we do have this two envelope system, scoring system. So the premium may range from 0 to 100. So it's my responsibility to review the policy to grant sites to private hospitals. So we'll have to look at the principles to propose conditions in the land grants for premium or various levels so as to benefit the public. And the Department of Health in monitoring the performance of private hospitals in carrying out routine checks and examinations, will make sure that the hospitals comply with the conditions of land grant. Can the Secretary for Development and the Director of Lands also give a reply? Paul, and then Director of Lands. Yes, Chairman. Hospital policies are formulated by the Food and Health Bureau, and the Department of Lands is responsible for writing down the requirements or inserting them into the grant conditions. In other words, the Director of Lands provides support to the Policy Bureau. Now, we do accept the Director of Audit's recommendations, and in future, there will have to be closer cooperation between the Director of Lands and the Director of Health. The two sponsoring departments need to work in close coordination to make sure that land grant conditions are complied with. We understand that there is room for improvement. Improvements are required. Now, the Policy Bureau is responsible for policy formulation, and the departments are responsible for implementation and enforcement. Director of Lands, concerning where we can do a better job in the future. Now, with regard to modification of lease conditions or land exchange, will take the opportunity to remind policy bureaus to look at the conditions to see whether further conditions are required, even though the amendments or revisions are purely technical in nature. And secondly, with regard to monitoring, members have already asked us questions, and I and the Director of Health have already given replies. I think we can reduce our verbal replies to writing so that relevant bureaus and departments know what to do. So, say for example, for certain facilities, for certain services, they should be monitored by the relevant bureau or department. Of course, we don't expect the DOH to, in her routine inspection, look at the parking spaces. But then at least we can state clearly the respective responsibilities of the two departments. We can reduce what we've said to writing so that the entire government knows what to do and which department is responsible for what. Ellen, now just now we referred to Table 2 and EXCO papers were mentioned. So you may consider whether you need to have access to the EXCO papers. Some explanations were given, but then we don't have all the details in the Director of Audit's report. So maybe during our closed-door meeting, we can look at Table 2 again to see whether we really need those EXCO papers in question. And that leads on to another question, and that is it that EXCO has the power to make changes whenever it thinks fit? And in the value for money audit, we have to look at whether the government bureaus and departments are aware of the changes made by EXCO. Now, so there was the policy laid down in 1957. Is it that EXCO can change it anytime? Chairman, I think we definitely need these papers before we write our report. I don't think there is a need for discussion on this. But I want to ask you whether you need the papers. But Chairman, I think our hearing can still continue even though we haven't got the papers yet. My assumption is that the Director of Audit has already studied the papers. And I believe he hasn't found very useful information in those papers. If he had found useful information, Part 4 of this report would have appeared or would have been written in a very different manner. Then perhaps we can ask the Director of Audit whether he has read any useful EXCO papers, the content of which is not fully reflected in this report. But then I can quite safely assume that those EXCO papers do not include very useful information for the purpose of this hearing. So is it that the EXCO can change 1957 policy if it likes? Is it that EXCO can just have a discussion and then change an important policy? That policy was intended to benefit the public. So I am inclined to come to this conclusion. But of course, our conclusions have to be based on facts. And so we need to have the facts. We need to have all the papers so that we know the rationale, so that we can look ahead. And in fact, the Director of Lands has said very clearly concerning her proposed way forward. But I think we really need to find out why this problem has arisen. I think it's useful that we study the papers. Kenneth, I really do not know what questions I can ask. So they said there were no records. They didn't know why the 2 salient requirements were not included in the grants or the leases. But I want to share with members my observation. It seems that the Development Bureau and the Food and Health Bureau are trying to shirk their respective responsibility to each other. We are told that the departments only provide support to the bureaus. The bureaus need to give advice on the leases or the grants. Now, concerning the leases, of course, there are standard lease conditions. And then secondly, the Department of Lands is the department responsible for lands matters. And I believe you know very well that there should be a set of standard lease conditions for hospitals, for schools, for parks. And if the sponsoring bureau has omitted certain conditions, it's the responsibility of the Lands Department to remind the Bureau as to what conditions should be inserted or included. And then is it that EXCO can overturn a previous policy? Now, maybe the Department of Lands is not in a position to give reminders to EXCO or to remind EXCO as to what it should do and what it shouldn't do. So can I confirm this with the Director of Lands? And Director of Lands, is it the Lands Department's responsibility to remind the relevant policy bureau of certain conditions that should be included in the lease or the grant? And then Mr. Cole, concerning table 2, LG3, LG4, Mr. Cole said that one of the possible reasons was the change of sovereignty in 1997. All leases had to be extended beyond the 1st of July 1997. So, Mr. Cole, was your remark based on official papers or documents, or was it that such a factor was considered by the Bureau in the run-up to 1997? Was it the Bureau's position that a smooth transition of the policy was more important than terms and conditions which could benefit the public? And then LG3, LG4, the expiry time of the current lease would be 2047. And then LG6, again, the time of expiry time of the lease will be 2047. And yet, both conditions, both salient requirements are in the grant. So, can I ask whether government departments did use their common sense when they did their work? All right. So, we are now talking about the principles. So, who wants to give an answer? Mr. Leung is raising questions about the principles. Director, Mr. Leung wanted to know whether we reminded the DFH or the Bureau of the need to include the two salient requirements. We don't have such records. According to the records, we haven't reminded them, but then it should be for the Bureau or the department to initiate the inclusion of the requirements in the grant. So, is it that I understand that at that time the Government Council could change almost everything. But I want to know the fundamental principle is that EXCO can, at any time it likes, overturn a previous policy. Paul. Now, of course, the EXCO is responsible for formulating and deciding on policies. We can see here that in some cases, the EXCO's final decision was not totally in line with the policy. And I believe the EXCO papers and records can show the relevant discussions. And Mr. Koh, concerning the renewal or the extension in 1997, whether I had a basis for making the remark, may I refer to Note 1? The Joint Declaration 1984, blah, blah, blah. Of course, I admit that despite such a principle, it didn't mean that we could not add anything. There was there could be a discretion to add extra conditions. And in fact, the Bureau did consider the matter. Of course, on the one hand, we needed to take into account public interest, and then on the other hand, we had to take into account smooth transition. It was merely a routine renewal or extension. But then adding extra conditions might affect the smooth transition. So I want to say that when I made the remark, there was a basis and the factor was considered. Mr. Leung, of course, there were two principles to be considered at the time. One of them being smooth transition. But I think this is a very serious constitutional issue. Was the Secretary for Justice or the AGC at that time consulted? Or was it purely the decision of the Bureau at the time? Now, I don't think we have papers showing that we consulted the AGC or the Bureau responsible for constitutional matters. And members were not talking about including new conditions in the grant. The grants after 1981 should have included the 2 salient requirements. So members are not talking about imposing or including extra conditions. Why was it that the 2 salient requirements were not included when the leases were renewed? They were not new conditions. They should have been there already. Mr. Leung, is that your question? Yes, exactly. I'm not too clear about the question, Chairman. Now we have 2 salient requirements. First, free or low charge beds, and then second, profits surplus plowback requirement. We want to have papers to show why in certain grants the 2 requirements did not appear, or only one of them appeared. And then in 1997 it was said that all leases had to be extended till 2047. And Mr. Leung would like to know the following. Did you take the opportunity to include the 2 salient requirements? Now, you said that you didn't want to include new or extra conditions. Mr. Leung is trying to say that, in fact, the 2 salient requirements should have been there already. So these are not new requirements. They were not new requirements at the time. I want to know more about the decision-making process of the Bureau. How come the Bureau decided to opt for a smooth transition at the expense of putting back the 2 salient requirements into the land grants, as the 2 salient requirements would benefit members of the public? Now, Secretary, can you do some research? Can you look at the papers?
You said there are such documents, but can you tell us more about the process, your internal process, or the Director of Audit? Can you help us here? I would like to take this opportunity to clarify a point. In our auditing process, what we have actually achieved, I would like to say something about that. As the secretaries and the directors have said, in relation to the granting of land to private hospitals, the process encompasses a long period, decades of will be involved, and some documents are there, some are not complete. In our auditing, if we came to realize that certain conditions may affect the granting of land, and also if we consider certain information to be useful to the reader, we will have put everything in. But are there other information which can more accurately reflect what went on in the process of land grant? Well, we cannot rule out such possibility. But in the auditing process, we were in close contact with the 2 directors. Some documents were not located, but there were certain hints here and there. But if there's no clear manifestation in certain documents, we will not be able to put such things, such information in the report. Mr. Ko, Dr. Ko, can we get more information to reflect on the issues raised, or to better clarify the points made by the Director of Audit? I will try to find out, but I cannot. I'm not sure about that. Well, when you say you don't have the documents, in the past, PAC sometimes could discover more. I think you have many old records and documents concerning land grants. In the past, we were able to get old documents, old land grants, for example. So I hope the departments can help us find the truth. We need the documents. I think, Paul, you understand this, being a former PhD member. Kenneth, have you finished? I have a third question. I want to get an answer from the administration. Did you follow the books strictly, or would you be exercising common sense? Well, I think in the government they follow the book. Well, I think I've stated the matter clearly. I believe at that time there was the due process to follow. They followed the due process. But of course, there may be a difference of opinion. That's another matter. Mr. Raymond Wong, and then Mr. Cheuk-fai, and then Mr. LEUNG Sing, and then Mr. Alan Leung for the second round. Chairman, allow me. Oh, we have a lot of time. We have ample time. I want to express my comments first. From what I've heard in this hearing, government officials don't really know a lot about the cases, so you're wasting our time. We have read the report, and we have made a lot of notes. You talk about there's room to make improvement. This is an open hearing of the PAC. And Mr. Po Chan, you were a PAC member. If you don't understand what the cases are about, ask your colleagues to write reports and briefings for you. In 1957, in 1981, that's before the handover, it's in the colonial era, but you have inherited the government, you have inherited all the policies. Have you changed the conditions? In the meantime, there were other changes. It's not meaningful to criticize the previous administration, but you are here to rectify things. We're talking about a few decades ago. How come the documents are not there? The documents might have been destroyed or burned. You have the official secrets legislation. We're not talking about hundreds of years. It's 1957, 1981, land grants conditions for private hospitals. The documents couldn't just disappear. All of them are new. You are a new Secretary for Development, and the Director for Lands have just been transferred from some time ago from the FSTB. Well, the AOs are generalists, but you all run the system. So please don't come to our hearing and tell us nonsensical things. And we are wasting time in trying to get a focus. Let me say this. We need to take remedial action. Please go back and learn about the facts first. I believe the administration and everyone in this meeting room agree that granting land to private hospitals on nominal or new premiums is done to do certain things. First, to provide free or low-charge beds, to share the burden shouldered by the public hospitals. Second, the hospitals should plow back their profits and surplus to expand their facilities and services. Do you agree that there should be such two requirements? Agreed or not? Paul, agreed? Okay. So it's agreed. And the policy can be traced back to 1957 in the British colonial era, and then in 1981 there was an elaboration. The audit report points out that in some of the direct grant cases, the conditions were not strictly or faithfully incorporated in the land grant leases. So is the policy enforced thoroughly in those cases? Are we just talking about land grant 1 to 8? According to the report, in some of the cases, the conditions were faithfully followed. Do you know which were the cases where the policy was strictly enforced? Dr. Ko first. I agree. What do you agree? Well, that's the table from the Director of Audit, which provide the detailed information. In some of the land grants, the original two requirements were there. In some other cases, there weren't. Do you know which cases belong to this category and others belong to the other category? Well, you can see it for yourself in Table 2. I'm not trying to play a game of words. I'm not trying to mince words here. You knew that a long time ago, or is it that after the Director of Audit conducted his investigation or published his report that you suddenly realized that there were such cases? Secretary, it's in the report, Chairman. I was asking them that although you knew that some had these requirements, some did not have this requirement, are you going to carry out a review? To be fair, I have to put the questions to the Secretary and let him answer first. In the course of auditing, of course, auditing took some time. Prior to that, the Department of Health had already paid attention to the matter, and the private hospitals were asked to provide information. Because prior to that, the private hospitals were not asked whether certain conditions were complied with or not. And for some considerable period before the auditing was done, the Department of Health had already been doing this and had already been asking for information. Director of Health, I can confirm that Dr. Ko is correct in saying that we only started to enforce this more stringently towards the end of 2010. Well, the policy can be dated back to a few decades ago. Did the department realize the issues when or before the Director of Audit started the exercise? You haven't answered this question. I hope the two secretaries can answer my question instead of saying that there is room for improvement. Did you realize that before the audit exercise, or did you consider ways to improve the situation during the course of auditing? As I said, prior to that time, we did not ask a lot of information from the private hospitals to confirm whether they had complied with the lease or land grants conditions. But when the Director of Audit, or before the Director of Audit started the auditing exercise, the Department of Health had already been asking the private hospitals to provide information for the purpose of confirming compliance. So the answer is yes. Before the auditor, the Director of Audit started his audit exercise, the department already discovered that there was a problem. And starting from 2010, they had started to ask for information from private hospitals for the purpose of confirming whether private hospitals had been in compliance. Well, that's a very good answer. That's a focused answer. All right, so you got the information from the private hospitals. You've discovered that there were problems. If the land grant conditions were not complied with, what did you do? Of course, we are not talking about a particular point in time. In 2010, it's not that in 2010 the Director of Health suddenly realized that there were problems and then they had everything clarified at once. Well, frankly speaking, we are still trying to get information now, because some information is complicated financial information or information on commercial operations. So the answer is yes. We realized that there were problems, and we were trying to get information, and then we can consider how things can be improved, implementation or policy. Maybe you can give us your letters or documents, correspondence to inform us of the action you've taken. Secretary, are we going to see improvement in the future grant of 2 sites in the future? So we are looking forward, well, for new grants, new land to be granted. We would see to it that, as a matter of policy, the benefits for patients will be reflected. We're not asking for low-cost beds. We're asking for transparency of charging, etc. Okay. Secretary for Development, I don't have anything to supplement. Mr. Raymond Wong, I have questions in 2 parts. The Director of Audit has uncovered certain issues which can be dated back to a few decades ago, and he found out that the land grant conditions have not been complied with. You are trying to get documents for us so that we can explore the way forward. As for new sites, of course, land is a scarce resource, and land prices have been rising drastically. Please please ask your question, Mr. Wong. I know this is a matter of concern to you, Chairman. Paragraph 2.6 states clearly that the Policy Bureau is the Food and Health Bureau, the Department of Health, and the Lands Department. And the Lands Department is under Mr. Paul Chen. Now this report has been published. Has the Development Bureau people tried to take out the lease documents to take a good look at them? Have you studied the leases? How many leases have you discovered before and after this report is out? Actually, the Department of Health started to take follow-up action before the report was published. There were cases where there were points requiring clarification. So we try to got the old leases and try to understand what they are about. But this is not the first time we have such an incident. In many previous reports, well, I've been working with the PHC for 12 years. We have seen such similar issues repeated again and again. It seems that we haven't learned lessons. Mr. Wong is asking whether the Lands Department, well, since you are responsible for land leases, have you looked at these leases or other leases? You don't need to go to the private hospital for such information. Dr. Ko has a hard time to get the information from private hospitals, but the Lands Department don't have to do this. Well, you want to look forward, I understand. What have you done in addressing the issues raised in the question? If we look at the leases, and if we just look at the leases in the department, it's not very meaningful. And we see the clauses and how they are worded, but we need to have a case, and then we put the context of the case and match the context, or look at the clauses in that context. That would be meaningful. I don't think it's very useful if we just study the leases within my department. Well, you decided how the leases were drafted and the conditions are in the lease, and whether the conditions are in the lease or not is a matter for you. So in Table 2, we know that in some land grants, the conditions or requirements were not there. So Mr. Wong is asking exactly what this is about. I think, well, she's making a good point. What's the purpose of just taking out the leases? But there are certain cases whereby the private hospitals fail to comply with the land grant conditions. And after so many years, maybe we should take some follow-up action. Now I understand what the questions are about. Of course, we can get the leases pertaining to these cases when we will know that for some of the leases, some of them do not have the salient requirements. Maybe there were subsequent short-term waivers or lease modifications. Were the conditions incorporated? And if not, when would be the next opportunity for us to do so? So all of these will be looked into. Do we have anyone in the queue? Yes, many of them. According to the Audit Commission, a number of opportunities were missed in incorporating the salient requirements in the leases concerned. Having read the report, I wonder whether there was any human errors or omission or systemic problems, and if we elevate the level, well, was a transfer of benefits involved in the cases? You miss a number of opportunities to incorporate the two salient requirements. So the responsibility rests with you, don't you agree? Dr. Code, what about the missed opportunities? That's correct. The responsibility rests with me. As I pointed out, in relation to a number of sites, the Medical and Health Department, the then Medical and Health Department, before 1997, because of the transition consideration, in accordance with the Joint Declaration, apart from grant for special purposes, all lease granted which would expire before 30th of June 1997 would be extended to the 30th of June 2047.
This question has been asked before. It's not the case that we look at this alone to make the decision. There is an important principle, and at the same time there is another important principle, that is, through conditions of the lease, we have to ensure that in the operation of the private hospital, a section of the public would benefit. But still, we do not want that to adversely affect the smooth transition. That's why it wasn't incorporated. And I have quoted a number of notes in Table 2 to explain that there are certain circumstances in which this condition was not applicable. Say, for example, it is in relation to quarters, or it is a part of the hospital that is not to provide beds. And there is another decision made by the EXCO. We believe that the administration has, the administrative department has taken into consideration all factors before a decision is made. Anything to add, Secretary Mr. Paul Chen? No. I have a follow-up question, a very quick one. Okay. Mr. Raymond Wong. We understand that well, there may be opportunities for a review of the land lease, say for example an expansion or for other reasons. Otherwise, the existing conditions will apply. But very often we see that these two requirements are not there. Well, you are empowered by the law to monitor the hospitals. So are there any alternatives to require hospitals to provide free or low-charge beds? Dr. Koh. Well, to look forward, the old conditions may not be suitable since time has changed. As reflected in the tender exercise of the two reserved sites, you can see that the conditions have changed. Say, for example, no less than 30% of the beds should be offered at package price. It shows that we are attaching more and more importance to free transparencies of private hospitals, and also a priority to be accorded to local residents, and also a balance among the different specialist departments. I'm still considering whether these conditions are pragmatic. I don't rule out the possibility that in the future, depending on the different discounts in the land premium, there will be different conditions, and it may not be limited to, say, for example, 20% of free or low-charge beds, or conditions attached to the 2 lots of land that is under the tender exercise. Say, for example, a certain percentage of the beds to be offered at packaged charge. Well, this is something to do with contract, the spirit of the contract. I think this is unfair. Well, how do you answer if you're only looking forward? I think how you change the conditions is not in relation to this report. What I meant was, how do you deal with those who do not comply with the requirements? Well, if you're talking about non-compliance of existing lease conditions, we can ensure that through administrative means, these will be enforced. Mr. Chan, Secretary, anything to add? No. Mr. Gary Chan. We spent almost 2 hours on these two requirements and whether they are incorporated or otherwise in the lease conditions. When I was reading Table 2, I have an observation and a conclusion, and I would like to see if the administration agrees with me. The 2 salient requirements was first proposed in 1957 and it was amended in 1987. When it was first proposed in 57, the first lease granted will contain these 2 requirements in 59, and but that was the only one. And in LG4 in 1981, you have complied with the revision in 1981. However, for LG3, that was granted in March 82, it wasn't complied with. During the revision, say for example, for the first occasion it was there, but on the second occasion it wasn't. So, is it the case that when you were dealing with the renewal, you remember that there was this condition, so it was incorporated? However, when it comes to another occasion when a land lease has to be granted, you did not remember this condition, that's why it wasn't incorporated. I understand that is a long time ago. But can you tell us that in 1967, during when when Hong Kong was in turmoil, and then also in 1987. Can you tell us? Can you explain to us why it happened the way it is? Just take into account what happened in history instead of just plucking it out of thin air. I don't really agree with what you said. I have gone through the individual situation of the leases and why a decision has been made the way it was, and there are also other reasons, say for other reasons, or because of incomplete information that we cannot remember clearly. But there are rules to be abide by. But can you give us some information? I'd like to follow up. The Secretary said that in the times of renewal, some had to do with the transitional arrangements, and they overrode the existing conditions. And I heard repeatedly from the Secretary the word may or it's possible. You said, Dr. Cole, that it may be possible that the transition issue may be more important than the individual policies. So can information be supplied to us after the meeting to confirm what you said? And it's not just the guesswork of the Secretary. Well, I think it's for them to decide how it is phrased. Secretary, can you answer this question? May I suggest that in relation to the individual leases, we will provide information on which the decisions were based on. He answered in this way because that's what he thought. Table 2. I have an observation to make. For F, you're talking about LG 8 or 9? 9. In 2010, the Lands Department asked for one of the requirements, that is 20% of free or 20% of beds are to be free or low charged beds, but it wasn't taken up in the end. The Lands Department is a professional department and they have the authority. Why, in this case, the Food and Health Bureau did not respect that decision and decided against the proposal to incorporate this requirement? Dr. Cole. I think you're talking about LG 8, not 9. At that time, the Bureau was considering different arrangements. That was a time when future policies related to private hospitals were discussed. And that's why a more flexible condition was incorporated, that is, to provide free or low charge beds as requested and to the satisfaction of the Director of Health. We did not put 20% there to maintain our flexibility. As I've said, we are reviewing such conditions to see if they can really meet or achieve the policy objective. We would first like to incorporate a flexible condition. It gives us room to maneuver, to implement newer requirements or to put in a different percentage to better reflect our policy? Secretary, can you reply to Mr. Chan? In 2010, has the review started? You're talking about June 2010. When did the review start? Is that part of the review? Yes, we've already started the policy review on private hospital development. Is that the result of the review? You started the review in 2010. So is LG 8 a part of the review and it reflects the result of the review? Dr. Chan. And 2.19. No. My question was simple. In reply to your question, you said the review was 2010. No, that was different. That was in 2010. That was a review of the Department of Health on implementation. And in relation to the review on condition, that was in relation to new land lease. So it's nothing to do with the Department of Health. Okay. Mr. Chan, any other questions? No. Next is Mr. LEUNG. I think the focus on this part is the provision of 20% of free or low charge beds. Note 1 and 2 under Table 3. In Note 2, it sets out the situation then. The Lands Department informed the audit that during lease extension they have sought comments from the Lands Department in relation to the proposed incorporation of the requirements, and at that time the Department of Health said that there was no proposal to incorporate them. So I would like to find out who has the power, the Department of Health or the Lands Department. If the Department of Health said that it should be incorporated, then how come under B in Note 2 that the Lands Department then informed the Department of Health that it was intended that the leases would be extended on the existing conditions? And only certain basic and essential conditions will be amended or inserted where there appear to be serious defect in the existing lease. So who exercised the power? I think there is confusion there. Well, in the first place, the Department of Health was asked if there was any need for any adjustments or revision. And then the Lands Department said that where there is no serious defect in the existing lease, there is no need to add anything. So we can't see who has more power. So is there a problem with the delineation of power here? Well, if there is serious defect, then the conditions would be amended. Who has the power to decide whether any amendments or otherwise is to be incorporated? I don't think this is a matter of a conflict of power. The DFH has taken reference in another piece of land that in 1990 the Lands Department invoked a principle which reflects the general policy of lease renewal to ensure a smooth transition to 2047. The Department of Health only look at health policies, and on that, when an opportunity arises, the condition should be incorporated. But the general policy was taken into consideration, and to us, it should override other policies, and it's based on this reason why there was no amendment. I've explained on a number of occasions. The stance we took was that during the period before 1997, lease renewal would be subject to this general policy. Mr. Paul Chan. I previously mentioned that we accept the report of the audit. The communication and cooperation between the DOH and the Lands Department can be improved. And as the Director for Lands said, that when it comes to future lease renewal, they will remind the relevant department as to what conditions should be incorporated. So the chance of a similar situation occurring will be slim. The Lands Department asked the DOH, and then the DOH gave a reply. Dr. Cole? The Lands Department did seek comments from the Department of Health. And the DOH was aware of this general policy. And we thought that this general policy should override other policies. That's why a decision was made to not incorporate the health policy condition. Mr. I think you need to look at the 20% requirement. It was set in 81, and it's an important decision. And in 2010, when there was a tremendous pressure on the public health care sector, and with this rigid requirement in place in 1981, why didn't you consider incorporating this requirement of 20%, or even consider raising it to 30%?
Why is it that you were merely proposing such a flexible arrangement to the satisfaction of the Department of Health only? So you're not requiring only 20%. You're only requiring that they should provide such service to the satisfaction of the Director of Health. So it seems that there is really too much room for maneuver. The Lands Department is correct in announcing that the conditions may be changed. So, in fact, the DOH was consulted. It did not require that the condition be inserted. So it was really an opportunity foregone. Now, the Department of Health should have seen the very acute demand for hospital beds. And why is it that the DOH has not asked for the enforcement of the 20%? So was it that the DOH at that time didn't really understand the policy or the demands in society? Mr. Cole, I think Mr. Ng is here talking about two sites. LG3, the Lands Department did consult the DOH. The DOH did not take the initiative to propose that the condition be included. And according to a 1990 paper, that there was the overriding consideration of smooth transition. So can you give us a copy of that paper? Yes. And then Mr. Ng then referred to LG8, the lack of the 20% requirement. At that time, the Bureau was reviewing the policy for the development of private hospitals. And at the time, we proposed the flexible arrangement of provision of such service to the satisfaction of the DOH. We didn't stipulate 20%, but then that meant that it could be 10%, it could be 30%. So it was not the DOH's decision, it was the Bureau's policy. And then the DOH in 1990 was of the view that because of the overriding consideration of a smooth transition, it would not be appropriate to include the two salient requirements in the extension. Mr. Ng. So under what circumstances can the Bureau or department decide to adopt the general condition, in other words, 20%? Now, because the flexible condition or arrangement is to the satisfaction of the DOH, so you can see that there can be two scenarios: a rigid or an absolute requirement, or a flexible arrangement. So under what circumstances would the first one be adopted? Under what circumstances would the second one be adopted? And is it really sufficient to provide the service to the satisfaction of the DOH only? Is it that you should consult the ICAC first, since some interest may be involved under such a flexible arrangement? And then the lease lasted for 50 years. So in other words, when it was granted in 2010 or extended in 2010, then the lease would not expire till 2060. But then concerning the 1981 requirement of 20%, you in para 2.18 say that there is no evidence to show that the 1981 requirements were deviated or departed from, and so EXCO's approval was not sought. But then when there was the grant in 2010, you stuck rigidly to 50 years. Now perhaps you need to declare interest. You were a member of the Land Commission, but that was very long ago. Still you need to declare the interest. I used to be a member of the Land Commission. Chairman. Secretary. Now, in future, as to what conditions should be included in what types of grants, and under what circumstances we need to go to EXCO, all these must be spelled out very clearly. When you're talking about existing leases, and the need to ensure that the lease is complied with, of course, we will have to make use of our administrative arrangements. Looking ahead, looking forward, we'll need to look at our policy. In other words, different conditions to be included to reflect the different levels of premium concessions or discounts. Now, concerning flexibility, our understanding is that it can be less than 20%, but then you said, in fact, it could be 30%. So, I really want to want you to further elaborate based on the spirit of the contract. So, is it that the flexible arrangement allows you to demand only less than 20%? Or is it 20% at least, and the director can ask for 30%? So, do you have a basis for making the remark? Now, Chairman, at that time, the policy was being considered, and we felt that there should be flexibility. But I do agree that with this flexible arrangement, if we ask for less than 20%, of course, they would welcome that. But then if we ask for more than 20%, they may challenge us for breach of the spirit of the contract. So I think we will be negotiating with them on the basis of 20%. And then concerning the conditions under the new policy, they will be implemented only after ICSCO has given its approval. Now, I can tell you that it's quite difficult to ask for more than 20%. But of course, when we put forward a flexible arrangement, the purpose is that we do not want to tie our own hands. All right, Ellen, I understand that you want to ask some questions, right? Chairman, I just want to use 10 minutes to wrap up part 2. Now, because Raymond Wong would like to ask some questions. All right, 10 minutes. Let's have a 10-minute break, and the secretary can also take a break. So we'll resume at 11:20.